We're going to start looking at the bony landmarks of the bones of the upper limb, beginning with the most proximal bone in the upper limb, which is the humerus that is located in the arm. We're going to use the right humerus and begin with the anterior view. You can see that the humerus is classified as a long bone. It has both proximal and distal ends with a shaft or diaphysis in between. The proximal end is known as the head, and this forms the articular surface for the glenohumeral joint. It is supported by a constricted region of bone known as the anatomical neck. And as we move distally, we see that there are two large bony landmarks. One is the greater tuberosity located laterally, and the smaller, lesser tuberosity located anteriorly. The function of these tuberosities is muscle and ligament attachment, and they are located either side of a groove or sulcus known as the bicipital groove or intertubercular sulcus. And this is for the long head of biceps tendon to run through as it moves to its proximal attachment on the scapula. As we progress further distally, the proximal end narrows to become the shaft, and it's this narrowing which is referred to as the surgical neck of the humerus. As we progress along the shaft, we see a slight protuberance on the lateral side, which is the deltoid tuberosity for the attachment of the deltoid muscle. And at the distal end, we see two articular surfaces, the capitulum located laterally and the trochlea located medially, and these are for the formation of the elbow joint. Above each capitulum and trochlea is an epicondyle, one laterally and one medially, for the attachment of muscles and ligaments. If we have a look at more detail at the joints that are formed by the humerus, the head articulates with the glenoid cavity of the scapula, and together they form the glenohumeral joint, which is classified as a synovial ball and socket joint. At the distal end, the capitulum articulates with the head of the radius, and the trochlea articulates with the trochlear notch of the ulna, and together these three bones form the elbow joint, which is classified as a synovial hinge joint. If we turn our right humerus to look at the posterior view, we can still see the head at the proximal end, supported by the anatomical neck. We can no longer see the lesser tuberosity, which is located anteriorly, but we can see the very large greater tuberosity present on the lateral aspect of the bone. The narrowing of the proximal end as it forms the shaft, the surgical neck, is still visible. And the deltoid tuberosity located laterally along the shaft can also be identified. At about the level of the deltoid tuberosity, there is a shallow groove on the shaft, which is known as the spiral or radial groove. And this is for the radial nerve, together with the profunda brachii artery and veins, to run through. At the distal end, we can only see the trochlea clearly, and above the trochlea, we can see both the medial and the lateral epicondyles.